Thank you, Madam Chair and members. I want to start by accepting the amendments as outlined in the analysis and thank your staff again for the work to tighten and strengthen the language of this bill. Poverty, especially during early childhood, can have a devastating impact on child health and well-being and undermines future educational and economic successes. AB992 creates the CalWorks Baby Wellness and Family Support Home Visiting Program to provide CalWorks recipients who are pregnant or parenting a child under age 2 with voluntary home visiting services from trained professionals. Voluntary home visiting programs are a proven strategy for promoting child health, strengthening parenting, and building family self-sufficiency. Through regular planned visits, trained professionals provide pregnant mothers and new parents with a range of supports to meet the family's needs, promoting preventative health and prenatal practices, coaching parents on how best to care for their babies and support their early learning, and connecting families to available services. AB 992 clarifies that home visiting services would only be intended to achieve the goals of improving child's health and family well-being and would only be provided by a certified nurse practitioner, or a certified social worker. This legislation established that the home visits would not be mandatory, random, or unannounced, and must be completed by a licensed professional social worker or nurse as described. The home visiting services would be evidence-based, and which has been established nationally with bipartisan support. Counties would have the flexibility to meet the local needs by implementing the program or partnering with approved home visiting programs that are working in local communities. Participating in the program would be entirely voluntarily for eligible families. Research shows that high-quality home visiting programs produce significant benefits for both the child and parents, including better maternal and child health outcomes, reduced child abuse and neglect, and improved quality of parent-child interactions. In the long term, children are healthier and more successful in school and less likely to have behavior problems or be arrested as they get older. The program also improves family economic self-sufficiency by increasing parental educational attainment, employment, and incomes. With me today in support and the sponsors of the bill, we have Jessica Bartholow with the Western Center on Law and Poverty. We have Michelle Stilwell-Pervinsky with the Children's Defense Fund, and Tanya Kemet with Black Women for Wellness.
Oh, okay. Thank you. So my name is Tanya Kemet, and I am a midwife and epidemiologist, and also the author of a first 5 funded home visitation program for pregnant women that over the last 3 years has been shown to reduce the number of African American infant deaths in Sacramento County. And I am here today as a member of Black Women for Wellness, and why we're in support of this bill. Many of what you've already said, but just strengthening the outcomes for both pregnant women and their infants, improve educational and economic opportunities, and increase the opportunities for families to move out of poverty. Home visitation has a really robust research evidence behind it, and beginning in the prenatal period, which is, my purview, pregnant women who receive home visitation have better outcomes, and also has a positive impact on breastfeeding, immunization rate, infant hospitalization, maternal depression, and stress. It also has been proven to improve children's school readiness, and all studies have shown positive impacts on their cognitive development and behavior, higher grade point averages, and achievement scores at age 9. Now, epidemiologists love immunizations, and And so I just, as an epidemiologist, I do want to point out that home visitation is one thing that can improve CalWORK's immunization rates. Research also shows that children in deep poverty are more likely to go immunized than other children, not due to parental choice, but because children who live in deep poverty experience multiple deprivations of their basic needs, and among them, medical attention. And we know that the deep public health implications of children going unvaccinated. And currently, according to California Department of Social Services, there have been over 30,000 penalties levied to families who have not proven that their children are immunized, and having a home visitor will help with increasing this rate. And I would also say that I have heard that there has been some opposition, some fear that the participants would not recognize that this program is voluntary. And having spent 20 years in this community working with many of the families that would be participants in this program, that has not been our problem. If you think about the Comprehensive Perinatal Services Program or Birth and Beyond or many First Five programs, we actually struggle with getting people to these good programs. And so I recognize that concern is real, but it's not really something that we would worry about. Thank you. Sorry if I went over, and thank you for your time.
Yes, thank you.
Michelle Stoll-Parvensky, Children's Defense Fund California, proud to co-sponsor this bill. I would just echo the comments that you already heard around the real benefits of home visiting that are proven by a robust amount of really rigorous research showing the benefits that home visiting can have for our children and families both immediately and in the long term. We know that the universal challenges of new parenthood are really compounded by deep poverty, and we need to be making sure that some of our poorest and most vulnerable families have the supports that they need, and this is a really way to do that. This is a way to improve the effectiveness of the CalWORKs program so that we can actually help families become self-sufficient, help provide them with the supports that we know they want to provide to their kids to foster healthy development. So we strongly support this bill and would urge your aye vote. Thank you.
Thank you.
Thank you, Madam Chair, members of the committee. Jessica Bartholow, Western Center on Law and Poverty, and we are a proud co-sponsor with Black Women's for Wellness and Children's Defense Fund California. Thank you. Urge your aye vote.
Thank you. Any other witnesses in support?
Lydia Bourne, representing American Academy of Pediatrics, California Division. Pediatricians certainly understand the need to have home visitors and are in strong support. As a former public health nurse, I can attest to the fact that women are very welcoming for you to come in and assist them with, especially with a brand new baby. So we are in support.
Monica Zemi with the California Alternative Payment Program Association, and we're in support.
Tiffany Whiten with the Service Employees International Union in support, and would like to thank the author for bringing the bill forward. Thank you.
Kathy Sutterly McDonald with the County Welfare Directors Association in support. Thanks.
And Wes Sams with United Ways of California in support.
Thank you. Any witnesses in opposition?
Good afternoon. My name is Jennifer DeLuggage. I'm a registered nurse with a certificate in public health and a lactation counselor. The following statement is on behalf of these organizations: A Voice for Choice Advocacy, Educate Advocate, Million Mamas Movement, VIAL, and Autism One. We oppose this bill in its current form. We have submitted amendment language to bill authors and sponsors that will alleviate many of our concerns. We are in full support of the CalWORKs program that aids many low-income families in our state. With that said, there are several problematic areas of AB 992 as it is currently written. First, though the language is described as optional, this is not accurate in practice. There is no requirement written in the bill to disclose that home visits are optional. CalWORKs recipients would be frightened that they need to comply with the home visiting program in order to receive benefits. Many are fearful to come testify and feel that a home visiting program would be an invasion of privacy into their home environment by way of random, unannounced, and mandatory home visits. Second, and this is related to the first point, though this is an optional program, there is no required advertisement that there is an opt-in to the home visiting program. Lastly, though the language of the bill says home visiting will not include mandatory, random, unannounced visits, currently the language states that it wouldn't be conducted by personnel that do not meet the qualifications consistent with paragraph 2, meaning a nurse or social worker could still conduct mandatory, random, unannounced visits. So though the bill states there won't be mandatory, random, unannounced home visits, there can be, just with particular professionals, including nurses and social workers. We would be happy to work with the authors and sponsors. Thank you.
Hi, my name is Denise Mendez. I am actually a caseworker for CalWorks. I was an intake caseworker for clients who needed to come in and apply for benefits. During this time, clients are an open book. We have to get their finances, their health records. We need information of every part of their life in order to make their case. With this language in this bill, it will frighten them to feel non-compliance means no benefits. So as far as the language that I've read, it doesn't seem as though there's going to be an area to where the client can opt out or information to let them know that this is voluntary. I'm not sure if if anybody has ever had a home visit here, but it's pretty intimidating for someone to come into your home and to sit and talk to you about your parenting or what you need. It feels as though you're not doing a good job at the worst time of your life. So I do oppose this bill in the wording.
Hello, my name is Gabriel Silva. I'm here to tell you as a former CalWorks recipient that AB992 is intrusive and intimidating. This bill will allow our families to be subject to evidence-based research judgments. This is an attack on personal and parental rights. I have experienced these programs firsthand and have had to jump through numerous hurdles. Every aspect of my life was an open book. I've had to constantly report changes. I have attended job programs and worked for my benefits through Welfare to Work. I assure you there is no lack of hurdles and no lack of stress. When I was on CalWorks, I feared any home visits and I felt very uncomfortable having a stranger in my home. I feared doing anything that might cost me the benefits my family depended on. Even when they said it was optional, I had an immense fear of declining these optional services. The last thing we need is to have mandatory home visits with a certified social worker and or nurse practitioner. It's one thing to hear about these programs and another to live them. There are many aspects of the current programs that need to be addressed to make them more efficient and helpful to success for the success of CalWorks recipients. I strongly oppose AB 992 due to the invasion of privacy and fear this bill creates, especially in relation to SB 18. There are many other aspects of these services that we need that need to be addressed for improvement. I want you to vote no on AB 992. Section 3 says home visiting services shall not include mandatory, random, unannounced visits or visits by any personnel that do not meet the qualifications consistent with paragraph 2, which refers to certified nurse practitioners or social workers. That to me says that if they are certified, mandatory, random, unannounced visits are going to be happening. So I want you to vote no.
Thank you. I'll go ahead and move the bill for discussion. Questions from members?
Can you answer some of the questions that has been brought up? Initially, I thought that this may be a good thing for the health of the unborn children, but after listening, maybe there can be a better way that the pregnant mother can visit to healthcare centers voluntarily rather than inviting or involuntary visitations unannounced. That's a huge issue. again, a government snooping upon the privacy just because they receive government, assistance. These are targeted for needy people, why not everybody, right? Because it does say that the temporary assistance for needy families. So I think it raises a lot of privacy, unwanted visitations. How would you handle that?
I've been as clear and direct as I can, Dr. Choi, that this bill, as the author's intent, will not lead towards any mandatory visits. These are optional visits that we will present as such. But I did like your framing at the start, which is the same framework which I work under. I'm thinking about the kids. I'm trying to think about those kids who are under 2 and how we need to be providing more resources to them, and want to make sure that we as a committee are working towards that goal of making sure that we're aligning best practices and evidence-based outcomes. This is the most effective manner that we have in trying to help and educate. I believe that based off of the evidence, and is the reason why we have pushed forward with this bill.
Yeah,
And I'd like to add, being, boots on the ground with home visitation programs. And I will say that our program in Sacramento County is actually built on relationships. And that is fundamentally the most important part of the program. And so the home visitor does not go into the home uninvited. They develop over time a relationship not only with the adults in the home, but also with the children. They're always asking me for a bigger budget for toys to bring and to have in their bags. And, so as a midwife, I find that home visitation, they feel like a backup to me. A woman delivers a baby in the hospital, and she doesn't interact with a healthcare provider. There's a 1-week infant visit and also a 6-week visit. And any woman here knows what it takes to get up and bring an infant to that 1-week pediatric visit. And then imagine if you're doing that in our inadequate transit system. So I remember a time when this was with the Sacramento County Public Health Nurse Program, and a nurse called me and she said, "You know what, this is your patient, and this woman has asked me to call and just ask you some questions." And between the three of us, this teenage mom who was at home with a 3-week-old baby and the public health nurse, we figured out that this was an infant that was in risk of failure to thrive, was not breastfeeding adequately. Mom's breasts were just a mess. I'm also a lactation consultant as well. And so and so I was able to, with the help of the public health, get the woman in for care that day. She wasn't sitting around wondering what she was doing wrong with her baby, and that was based on relationships. And I think that this bill speaks to that, as you've said multiple times. Absolutely voluntary.
Also, can I make a comment? I just got off the classroom as of December 1st. I spent 16 years teaching, and we had a home visit program, and it was voluntary, and it is definitely based on relationships. So I would talk to the parents and call them and say, "Hey, do you need some help, some support with the student?" So once the parent gave me the okay, I would load my box up with goodies and flashcards and some tools for them to assist them at the homes. Not until after I got confirmation from them did I visit, and it was an optional program. And I actually was the one that made the contact. It wasn't necessarily the parent. I would say, "Hey, your student is struggling. Would you like me to come and visit your home?" Specifically because some of these parents had multiple children. One of them was in kindergarten, the other one was in 3rd grade, and one was in high school, so they didn't really have the transportation nor the time to come and see me. And so I would go visit them, give them the tools that I thought they needed at the time, which feels like exactly what you're talking about. But as a professional, as a teacher, I would call first and say, hey, this is what I can provide for you. And some of them said, no, thank you. And I say, thank you very much. If you need me again, I'll provide you the information, but I would send, those tools. Again, it's very different than what we're talking about here, but I think the concept is the same because, again, it was up to the parent to let me in their house, and I probably visited about 99% of my students because of that, because it was relationship based, because they trusted my judgment and they trusted the information that I was giving them. And if you have a relationship with those patients, they already trust you because they were your patient or you've done some help from them. So I appreciate your concern, but again, I think that if we really look at the conditions of some of these folks that can't be transported or go to get the help that they need, I think it's important to give them that option. And again, as a professional, I would always make that call and give them the option. So I wasn't just showing up at their home just because, and a lot of the parents that I served were in a low-income community, so a lot of them were on CalWorks, and to be quite frank, a lot of my students' parents were undocumented, so we have that added fear of the visitation. However, because of the relationship that I had with them, I would call in advance and say, hey, do you need some help? And 99% of the time, they did need that help. They just didn't know what to do. And for me, this feels like we're offering some assistance. I have 2 children myself, and they don't come with instructions. Unfortunately, the kids don't. And I was an older mom and thought I could handle anything. And really, when you have a newborn, everything is brand new. So I appreciate you taking the time to express your concerns. However, in my opinion, because of the background that I have, I was very, very cognizant of the fears and always offered the option. So thank you for bringing this by. And again, I appreciate your concerns, but I'm looking at it as a teacher and, also a professional. And I believe that the folks that are here are professional and would do everything possible to make sure to make it an option and not necessarily a mandatory. Thank you.
Yeah, can I just follow up on my own questions? Reading the bill's home visitations, as opposed to your concerns, the home visiting services shall not include the mandatory random unannounced visits or visits by any personnel that do not meet the qualifications consistent with the paragraph 2. So it does say in there, so I think...
There's may I say one clarification? There's a number 3.
Just one more, please. Go ahead.
I'm sorry. There's an or statement that if it's, there was an amendment that was submitted that would fix that, but I'm not an attorney, but I think that or statement sort of leaves the door open legally, that someone could come, otherwise, because it says home visiting services shall not include mandatory random unannounced visits or visits by any personnel that do not meet the qualifications consistent with paragraph 2. So I know that particular section
So
yeah.
I know we have a follow-up discussion for next week with the opposition and are happy to discuss this. We did receive the amendments late last night, so have not been able to process and include them. And yet, as clearly as I can state, the intent is not to provide mandatory visits, that these are voluntary and optional and meant to assist. So for what that's worth.
Thank you. So I made a motion. Dr. Choi, would you like to second that?
Yes, I will, even though I have a little bit of concern about the funding necessary, but since it's not indicated here,
Right.
it's an appropriations job, to visit all the pregnant women in the state, that this will be tremendous amount of money. Right. How we can afford that, that is a little bit of concern, but I will leave it up to the Appropriations Committee whether they can afford it or not, for the concept, for the well-being of children. In that, I will second it.
Thank you. I have a motion and a second. Do pass as amended, and since we don't have enough members here, we'll place it on call. Or,
Yeah.
We can go ahead and call.
Okay.
You know, put it on call after we vote.
okay, so actually, if you can call the roll, please.
Does you want to close?
Do you want to close, Dr. Arambula?
I humbly request tonight.
Thank you.
Rubio?
Aye.
Rubio, aye. Dr. Choi?
Aye.
Dr. Choi, aye. Arambula?
Aye.
Arambula, aye. Gonzalez Fletcher? Mainshine? Stone? Thurman? Okay, we need one vote.
Thank you. Thank you. All right, my turn.